So I guess we should get started. We do have a lot of information to cover today, and I will stop periodically to allow questions about the topics we've covered so far. And then at the end of the session, we will allow a lot more time to hear your questions. And of course, my information is in the slide deck. So if you have follow-up questions, you're welcome to contact me directly. So what are we doing today? Let's just make sure everything is working. So I just want to say thank you to Charity Village for inviting me. I know that this topic about mental health in the workplace is something that we feel really strongly about here at CMHA. And I know our CEO here at BC Division has been suggesting that this might be a topic that not-for-profit organizations are very interested in learning more about. And I was very pleased to hear that we had a lot of registrants for today's session. So thank you, Charity Village, for bringing this topic to the forefront. What we're planning to do today is I'm going to go through a few introductions about who CMHA is and also about who I am. And then I'm going to provide a small overview about Mental Health 101. And really, this is such a big topic, I'm barely going to touch the tip of the iceberg on this topic, but we will start there. And then really what I'm here to do today is to make a case for why this needs to be a priority for the not-for-profit sector. So I'm going to go through the legal, economic, and social pressures to make it a priority in your workplace. Then I'll talk a little bit about psychological health and safety, and I really see this as a new way forward for nonprofits. There have been a lot of resources made available to organizations of any size, whether they're for-profit or not-for-profit, to start to make progress on this issue. And so I will review quite a lot of the resources available, and I will talk a lot more about psychological health and safety and what that really means. And then I will talk about, again, additional resources that are available across the country, and then I will take time to answer some of your questions. So who are we? So who is the Canadian Mental Health Association? I think those of you in the not-for-profit sector, we all know each other quite well, and so I'm assuming that many of you have heard of us. We are one of Canada's oldest national charities. We will be 100 years old in 2018. And everything that we do here at CMHA, and this is part of the reason that I was so attracted to the organization, is because I think there's a lot we can learn from listening to experts and researchers and listening to science and trying to translate that. I think the other part of the equation is listening to people with real life experiences and trying to understand how we can learn from their stories and their experiences, because quite often illness of any kind is very different depending on the individual and mental illness. So the more we can hear from different people's stories, the more we can learn. And everything that we do here in BC for the Canadian Mental Health Association, and gradually more so across the country, we do include addictions within our mandate. So our vision is mental health for all. We have 120 branches throughout Canada, and here in the province of BC, which is where I work, we have 14 branches. This is a picture of me so you know who you're hearing from today. I'm the Director of Community Engagement for the BC Division. So I work for the provincial office here in BC, and across the country we have provincial offices, division offices, and then we have branches in communities across the country. We also have a national office that works out of Ontario, Ottawa, and Toronto. I am a certified mental health works trainer and a certified CMHA psychological health and safety advisor. I actually have a background, I worked in the private sector for over 10 years before moving into the not-for-profit sector. I have a master's degree in conflict resolution and a bachelor's degree in political science, so I come at this from a different perspective. I don't have a clinical background. But I won't answer any questions specific to mental illness or mental health from a clinician's point of view, but I will be able to refer you to some resources. So to start with, about mental health. So what is mental health? So mental health is a state of well-being in which you realize your own potential, can cope with the normal stresses of life, can work productively, and are able to make a contribution to your community. I think this is a really important definition, and I think it's something that we should all sit down and look at and consider our own mental health. So if CMHA, our vision is mental health for all, I guess my question to you is, based on this definition, do you believe you have mental health? And if not, what are some of the things you can do differently in your life to achieve it? And I think that stress does play an important part of our lives. It keeps us going. Work is an important part of our life. It's a social determinant of health. And quite often, the workplace does cause us quite a lot of stress. And the American Psychological Association did a survey, and they said that 51% of employees said they were less productive at work because of high levels of stress. So I think stress is something, it's a starting point for having this conversation, but the end result is really that we're trying to achieve mental health. So this is just a bit of a graph to talk about mental health and the continuum of mental health. And it's not, quite often we see in very many situations, we see graphs where it goes from green to red, and red is illness, and green is the ideal situation that we're trying to find ourselves in. Quite often people, they think of mental health as being something they strive for, and mental illness as being something else. But really, we're at CMHA, our vision is really to look at mental health on a continuum. And the fact that we are all kind of moving around the circle and striving to stay somewhere within the middle, but recognizing that we all have days where we feel worry, we feel fear, we have days of high energy, low energy, sometimes we feel distracted or withdrawn. And really, when we start to talk about illness, we talk about mental illness, we talk about mental ill health, we're talking about the outside of the circle, which is where we're talking about impaired function. And it's when we stay on the outside of the circle for a period of time that we really start to consider that illness. And some of us will bounce around the circle, and some of us will hit the outside of the circle at some point in our lives. But hopefully we won't stay there for very long. And when we talk about employee mental health, and I do a lot of presentations on workplace mental health, and that's what we're talking about here today, we often focus on the frog. We talk about the one individual within an organization who might be struggling. We talk about that, you know, quite often the reason organizations are contacting us is because they've had one particular employee who has struggled with mental illness in the workplace, and they have recognized that it had a ripple effect on everyone else, and they wanted to do some training. And I think what we're trying to pursue and what we've been working towards over the last, I guess, quite a few years, so you know, the last 15 years or so with the CMHA, is starting to looking at the pond and really starting to think about, should we be focusing our efforts solely on the individual and empowering the individual and making the individual more resilient and more able to cope, or should we start looking at the structures around them and how can we change the communities in which we live in to be more supportive? And so I guess what this presentation starts to talk about is how can we create a framework in our workplaces where employees can achieve mental health and can go back to their communities and make positive contributions. So in terms of the risk factors on an individual basis, we all face risk factors in our lives for developing mental illness. And for many of us, we say it's 1 in 5 who experience a mental illness at some point in their life, but I would say that almost all of us have a direct connection to somebody with a mental illness or an addiction, or including an addiction. And so genetics is definitely the first risk factor that a lot of people identify or consider. And in my experience, my dad had a diagnosis of bipolar disorder, which is part of the reason I work for the organization today. But what this meant was that in my family, there was a recognition that mental illness experience was part of our family story. And so it was something that we needed to all pay a little bit more attention to. The same way families with a diagnosis of breast cancer might be more aware. So genetics is one of the risk factors. A personal history, so if at some point in your life you have experienced a mental illness, you are more likely to experience one again. Another risk factor are personal factors. So, I mean, in every story, every time I've met someone with a story of mental illness, and I meet quite a few people who come up and tell me their stories, personal factors play a role. So finances, you know, relationship stress, workplace stress, these things all contribute to our mental health or mental ill health. Another one that quite often people identify are trauma. So that could be an illness, that could be a physical illness, it could be an accident, it could be a different experience in your life. And trauma can be many, many different things to different people. We often associate trauma with veterans coming back from war because we are expecting that they have experienced significant traumas. But trauma can mean different things for different people. And sometimes they might seem inconsequential to someone else, but I would recommend that we don't pass judgment on what other people's traumatic situations are. On the flip side of mental health risk factors, we have protective factors, and these are the factors that help protect our mental health. And this is an opportunity for workplaces to be a positive contributions to employee health. So the first is social support. So those are the relationships that you have in your life. They could be relationships with colleagues, friends, family, neighbors. They definitely create a protective barrier for our mental health. Personal resilience. So although I did start off by saying we don't want to focus entirely on the frog, all of those pieces around, your physical health, your emotional health, what kind of coping skills you have, trying to develop an optimistic mindset, those components are protective factors. So it is worthwhile to still focus on those, just not exclusively. A sense of belonging. So quite often, recently I was up in the Northwest Territories, and I met with one of the elders up there, and I talked to him about his stories of mental illness, and he had many of the factors, the risk factors we talked about. He had an experience with the residential schools, which was his trauma. He was experiencing significant relationship stress and financial stress. And one of the things that really helped him to stay well and get well, and something he continues to connect with, is his community. So, connecting with the elders in his community and those he grew up with, and connecting to the cultural aspects of his childhood, that really creates a sense of belonging for him, and that's a protective factor for his mental health. And then the final one is environmental factors, so workplace, community, home. These are all areas that can have a positive contribution, so let's try and make them more so. So these are some statistics. I don't think anyone on the phone or anyone on the webinar today would be surprised to hear that 1 in 5 of us will have a mental illness in our lifetime. This statistic is well represented across the country. It does include addictions. So, if we were to take addictions out of this, it might be 1 in 7. So, just to consider that when you're thinking about addictions or mental illness, not to just focus on, depression, anxiety, schizophrenia, some of the ones we're more common or more familiar with. The Conference Board of Canada did a survey several years ago, and when they interviewed employees, they found that upwards of 40% have said that they are experiencing or have experienced a mental health issue. So this might not be a diagnosis, but that's a significant number of people that have said that they are having or having had experienced a mental health issue. So most of the 1 in 5 will have a significant episode between the ages of 18 and 65, which is when we're in the workplace, which is why it's a priority for workplaces. And 2 out of 3 will not seek help. And if I was doing this in an interactive way, I would ask you why you think people don't access help. But what I'll tell you are the responses from groups. And quite often the first word they come up with is stigma. And I think whether you're in the for-profit sector or the not-for-profit sector, or you're self-employed, or whatever it is that you're doing, stigma does play a significant role in whether or not we access help. And I think we mean many things when we say stigma. So in some environments, people are reluctant to access help because they're actually fearing discrimination. They're worried that if they come forward and ask for help, this happens in quite a few first responder communities, just as an example, is that they feel like they will be passed over for other opportunities within the workplace. They feel that people will treat them differently. And I think that really is a fear of discrimination. Sometimes people don't know that they're experiencing a mental illness, or that what they're feeling has a name. So that might be one reason. So it might just be a lack of knowledge about mental health or mental illness. Sometimes they just aren't aware that anything's changed. Like they might think or feel that something is different, but they assume no one else is seeing any of the changes. So they might have some doubts about that. Another individual, it was a man that I spoke to up in Quesnel recently in British Columbia. He said that he didn't ask for help because he's always been able to help himself. He's always had the coping skills that he needed to get through anything. So it wasn't really within his repertoire to ask someone else for help. So it was just that grin and bear it and work through it. This is all part of the the life experience that we'll all have. So that might be another reason people don't ask for help. And some people are just really in denial about whether anything is wrong. The other reason people don't ask for help is sometimes there isn't any help available. They might live in a remote community. They might not have a lot of supports available to them through their employer, for example, and this is quite common, I think, with a lot of addiction issues, is that they're not really sure that help is out there, and in some cases they're right. So before I move on to the next section, I just wanted to take a minute just to see if there were any questions. Marina, have any questions come in that we should address?
I think we're good for now, Julia. I think we can carry on.
Thank you. Okay, so this is the business case. This is where it gets interesting. So those of you who are on the call who are either in leadership roles or who work for not-for-profit organizations that are interested in making change in this area, I'm going to go through the business case for making change. And I'm going to appeal to a few different arguments. I'm going to appeal to the legal argument. So if you have a leadership team or a board who are moved to action due to risk, I think this might be an argument you can consider. If you're an organization that's really very much focused on the bottom line, I will also make an economic argument for making change. And then the final one is really the social or humane appeal. And I think that's something that not-for-profits need to pay more attention to, because quite often our values are integral to our success. So to start with, it's the appeal to the legal argument. So employers have significant responsibilities in the area of mental illness. The first, and some of you are likely familiar with this, is the duty to accommodate. So if an employee has a disability, you have a legal requirement to accommodate to the point of undue hardship. And I think sometimes we think that undue hardship is easy to prove. Well, it's not. It's very, very difficult. It's very difficult to prove. And so basically you are required to accommodate to the point of undue hardship, which means to the point of whether or not this accommodation would threaten your entire sustainability. And quite often that's very difficult to prove. So just like with a physical disability, if we have an employee that's coming in, with a broken leg and they just need to elevate their leg, that's something that you would need to accommodate. It would be, no one would ever consider terminating or not accommodating that employee when they're coming back to the workplace unless there was another reason for why that accommodation was not safe or possible. So this is the first piece, and duty to accommodate is complicated, and it is worth its own webinar entirely, and I think that Charity Village either does or could host a whole session about this. But just like with physical disabilities, employers have a legal responsibility to accommodate a mental health issue, and quite often, if they know that there's a disability, these accommodations are not significantly expensive. This might be, addressing scheduling, creating more flexibility within the workplace, allowing them to leave to go to appointments. It'd be very difficult to prove in a court of law that that was undue hardship for an organization. I don't know if anyone's ever been successful at proving that, having a 5-minute delay on their start time or something like that would be threatening their sustainability. And it might be more than 5 minutes, but that's the first point. So the second piece is the duty to inquire, and this is where case law is getting interesting, because if you know your employee has a mental disorder, then you're starting to have much more of a legal requirement to pay attention to the changes that you might be witnessing and inquiring about what is the reason behind some of those changes and whether there's a connection between the changes you're seeing and the underlying diagnosis that you may be aware of. More generally than that, I think employers, if they're starting to see changes in employee behavior, it's not a given that you can just go to performance management. And in some industries, that's a knee-jerk reaction, is to see irritability or with an employee, or see a decrease in productivity or an increase in errors and move directly to performance management. And quite often that's getting them into some legal issues because there might be more to the changes in behavior that you're seeing. So I would suggest some education for your organizations about these two topics.
Julia,
questions I have for
Sorry,
Yep.
can I just interrupt for 1 second and just ask if you could try to speak up
Yep.
just a little bit? We're having a few little audio issues for a couple of people.
Sure, no problem.
Thank you.
So the questions I have for the not-for-profit sector are, you have the same legal responsibilities as a for-profit organization when it comes to employee health. So have you considered the psychological and physical risks in your organization? Are employees prepared for the situations they work in? Are supervisors trained to respond to signs of ill health? And do you have policies to address and prevent bullying and harassment? And if I met one of your employees, would they know about them? Would they know about the policies? Would they know about how to report bullying or harassment or problematic behavior? Those are just some of the questions I think that not-for-profits could start paying attention to. So let's get to the economic argument. So I'm quite sure that all businesses, regardless of whether they're for-profit or not-for-profit, are paying attention to the bottom line. And mental illness in the workplace has a cost. And if there are stressors in the workplace that are contributing to an increase in mental illness in the workplace, then of course that's something where businesses can make change and see an impact to their bottom line. So there is an impact to productivity. Businesses, whether they're not for profit or for profit, are coming to us on a regular basis asking us for our help because they're seeing an increase in absenteeism. So sick days are a cost to your organization. And if the stressors in the workplace are contributing to an increased usage of those sick days, then you have an opportunity to decrease those costs. The other piece is people coming to work and not being as productive as they could be. And when we spoke about that earlier statistic about employees facing stress and that is impacting their productivity, well, here's an area that we can make change on. Employers are often looking at drug costs and disability costs. So if you have significant disability costs in your organization, then you can actually affect change by addressing mental health in the workplace on a preventative basis. So, one of the organizations, I'll talk about them in a minute, but that we will be profiling at one of our conferences, they've implemented a peer support program in their organization where they're enabling workers to support other workers, and they have seen a positive impact to their disability costs. They're seeing a decrease in their short-term and long-term disability costs by addressing mental health on a preventative basis. Drug costs is another area. If those of you who do have benefit plans, you can easily access some information about your benefit or your drug cost usage from your benefit provider, and that's an opportunity for you to look at where you're spending your money and how could you be spending it differently, or how could you be spending less. Retention, so that's another economic argument. So quite often the stressors in the workplace, the situation, the psychological risk factors that we expose our workers to may result in their decision to leave the organization. And every time someone leaves our organization, a trained employee, we have to recruit, we have to train again. And that's a significant cost for workplaces. So retention is something that organizations can spend more time focusing on. This will come up again later, but quite often we do exit interviews. We don't necessarily do interviews with employees while they're in the organization to find out what are some of the changes and the small changes we can make and how can we keep them. So the economic costs are significant. Across the board, 30% of disability claims are due to mental health issues, but in 75% of claims, depression is the secondary diagnosis. So, they're saying depression is set to be the #1 cause of disability worldwide. I would say, in this case, when I'm talking about depression being the secondary diagnosis, it's the fact that when people leave the workplace, even if it is for a physical health issue, quite often that detachment from the workplace, that sense of isolation that's created by that physical illness, sometimes, those protective factors that exist in the workplace around social support, those aren't there. And quite often people will experience depression as a secondary diagnosis. Again, I spoke about this earlier, the Conference Board of Canada interviewing employees and finding out that more than 40% have experienced a mental health issue. This is 44% was the exact stat. 500,000 Canadians miss work today due to a mental illness. The cost to the Canadian economy is $51 billion. And the average company and I would say this is true for not-for-profits as well, loses up to 12% of its payroll to employee disability through loss of productivity and sick leave. So if you want to make the economic argument, try and find a way to make a case to your leadership and your board about how you can recover that 12%. So here are the questions that I have for the not-for-profit sector. So nonprofits are in an excellent position to recruit high-quality candidates, but hiring is always costly. So what are you doing to retain your employees? Have you addressed absenteeism and examined the causes of high sick leave or burnout? How often do you or your board review drug spend or disability rates? Have you connected with your benefits provider to see how your rates compare to other sectors? And do you have processes in place to support employees who need access to psychological services? So this really speaks to what are you doing on a proactive basis to support employees? And is EAP enough? So those of you who don't know what EAP is, it stands for Employee Assistance Programs or Employee Assistance Plans. It's also called Employee Assistance and Family or Employee and Family Assistance Plans. So the question is, what are you doing to provide preventative psychological services to your employees? So that could mean, as part of your drug plan and your benefits plan, that you have an EAP available to you. And quite often that means that they would have up to about 5 sessions per issue. So employees that are experiencing significant stress in the workplace, for example, they could access an EAP. Or perhaps the work that you're doing is exposing them to significant risks in terms of their psychological health. Maybe they're dealing with very difficult situations with families and with individuals. And they're quite often, I think employees in the not-for-profit sector are so committed to the work that they're doing that sometimes that actually puts them at risk because they push themselves a little bit more than they maybe should because the work asks that of them. So if they do need access, they need someone to speak to, they need counseling support. An EAP service may provide that. But what I'm asking as well, and what I think the boards should be asking, is if you are putting your employees in those sorts of situations and you're providing an EAP, is that enough? And maybe it's not. And maybe you need to start looking at psychological services as part of your benefits plan and making those available to employees so that if they do have an issue and they need more than 5 sessions to talk about it, well, maybe they can access a counselor on their own. So I think this is where it gets interesting for not-for-profits. It's really the social or humane argument. And, you know, mental illness, it affects more than just the workplace. So yes, it affects the bottom line. It exposes you to legal risks. But mental illness is more than just the workplace. It affects families, communities, larger systems. And all organizations, especially not-for-profits, are accountable to the communities and the countries in which they operate. So these are some of the questions that I would pose to the not-for-profit sector. And I don't say this because we don't also struggle with the answers here at the Canadian Mental Health Association. And I'll talk about some of the things that we've been doing just in a little bit. But mental health is a state of well-being. I'll say this again, I think I've said it already. It is a state of well-being in which you realize your own potential, can cope with the normal stresses of life, can work productively, and are able to make a contribution to your community. Do your employees have positive mental health, and to what extent is your board concerned with the answer? And if not, to what extent is the workplace responsible? And please know that the workplace can be a risk factor, it can also be a protective factor. And I think not-for-profits have a greater responsibility to create environments in which it's a protective factor for their employees. And they have a perfect opportunity because quite often they're employing people that are very committed to the cause. So these are my sort of themes around this. So at the end of the day, your employees are really your most important allies in a competitive arena. How do they speak to your organization? What do they tell people about your organization? Are you listening to what your employees feel, think, and say about your organization? Do you know? And then the second piece is, and this relates to CMHA on a significant basis, but Do you have a self-defeating mission? Are you inadvertently contributing to society's social burdens by ignoring the psychological risks your organization is exposing your employees to? A bit of an interesting circle. For us at the Canadian Mental Health Association, let's use us as an example. If we're creating an environment in which employees are exposed to significant risks, are taking significant time off from work, are needing to access the healthcare system more so, and they are facing risks to their psychological health, or they're facing psychological ill health, then aren't we sort of creating the same problem that we're trying to solve? And I'd say that that would be true for a lot of organizations, because we're all committed to the good. We're there to do no harm. But if we are creating an environment where employees are exposed to harm, then we really need to be self-reflective about that. And then in terms of the fundraising piece, and I think this gets back to the economic argument as well, but I'm calling it from Yelp to help. So if you were donating to a charity, would you be less inclined to donate if you read negative reviews about the organization's internal workings? I mean, I can rate my son's teacher. I can rate my doctor. I can do so many things online. Before my son transferred schools, I looked at the ratings of the teacher. These are things, I'm making big decisions in my life, and I'm looking online to see what information is out there. And I would say that rating your teacher, the reviews are very mixed and sometimes very biased, but that could be happening with your organization as well. So really, we need to be concerned with our own reputation. Our reputation means almost everything to us in the not-for-profit sector. So it's just something to consider. One day there will be a site where we can rate, or employees can rate and there probably is. I probably haven't done enough research. But imagine if a charity, if a donor saw that information. Do you think that they would be inclined to donate somewhere else? I'm thinking probably yes. So before I keep going, maybe I should take another minute. Marina, was there anything else that's come up?
Sure, yeah, there's a couple of questions that I think relate to the material you just covered, so let's jump in with some of those. First of all, a question that we received from Twitter. If you have a mental illness and you are currently stable, should you still inform your employer?
That's a really good question. I think most of the employees that I've come into contact with would probably say no. I mean, really, it's none of their business. Sometimes I think, so if you have an ongoing physical health condition, do you need to inform your employer? Probably not. Again, this is a very difficult situation because I think there is a lot of discrimination in workplaces. So, in a perfect world, yes, you would want to let your employer know so that you could access the supports you needed and ask for small accommodations along the way to ensure that you could sustain and maintain your mental health. Yes. But do we live in that situation? No. And even in the not-for-profit sector, which is very competitive sometimes and very high stress, I would say that would be an individual decision, and it would be based on your relationship with your employer. But there will be a lot of people that would say absolutely not.
Great. And in regards to the proactive element that you were talking about, Julia, sometimes certain organizations in certain sectors find that their staff are particularly exposed to potentially traumatic situations. The question that came to us was about workers that maybe are going overseas, working in disaster relief, things like that. Does the organization have a duty to provide proactive support, or is it more just dealing with things as it comes up when the workers come home in a more reactionary way?
I guess it's, do they have a moral responsibility? I'd say yes. Do they have a legal responsibility to, and they do have a legal responsibility to adequately prepare and orient employees, but I think some of those decisions. I'm not a legal expert. I'm not a lawyer, so I don't know the official answer on some of those questions. But I think best practice is yes. Like, you want employees to go overseas and be successful, so you have to create an environment where they can be successful. You have to provide them with enough training so that they can have a positive impact, because that's what you're trying to do. So And really, if they come back more damaged than when they left, and they aren't able to return to that environment, then you've just lost a great employee. And now you have to pay to have someone else take their place or recruit. And so really, if you can provide some of that training up front, aren't you saving yourself costs in the long run? And isn't it the right thing to do? I guess that would be my response.
Wonderful. Thanks, Julia. I think we can carry on.
So before we keep moving, if there are organizations on the call that believe that they're doing a great job of addressing employee health, employee mental health and physical health, we would love to hear your success stories. And every year we issue a call for employers to submit applications for our CM Hinks Award, and CM Hinks is the founder of the Canadian Mental Health Association. So if there are organizations on the call, please do click this link once we send out the handouts to you. And just as a reminder for those who are new on the call, we will be sending out the slide deck with all of these links active. So you will have access to that likely tomorrow. For those of you who still need a little bit of help, are interested in learning how to do things differently, let's move on to the next part of our presentation, which is a new way forward for nonprofits. So CMHA has been working in workplace mental health. The Canadian Mental Health Association has been working in workplace mental health for almost 20 years now. And several years ago, the Mental Health Commission of Canada was created, and Louise Bradley is the president and CEO, and she issued a statement saying it's time to start thinking about mental well-being in the same way as we consider physical well-being, and the standard, and I'll talk about what the standard is, offers the framework needed to help make this happen in the workplace. So several years ago, they decided to move forward with addressing psychological health and safety in the workplace using sort of a risk management approach. So I'm going to start talking a little bit about what we now know as the National Standard for Psychological Health and Safety in the Workplace. And so this is a safety standard issued by the Canadian Standards Association. It was commissioned by the Mental Health Commission of Canada and was supported through funding by the Government of Canada, Bill Canada, and the Great West Life Centre for Mental Health in the Workplace. And it was issued in January of 2013, and since then, organizations have had a structure to address the pond. So if we're going back to our analysis with the frog, this now provides organizations with a framework to create a safer and healthier pond that really does take into consideration the psychological health needs of their employees. So this is what I'm going to spend a little bit of time talking about, and this is something that we here at the Canadian Mental Health Association, our BC Division Office, has been working to implement, and that branches across the country have also been looking at. It is a free standard. It's quite a long read. It's about 75 pages or so. So it's not something you necessarily can get through in 15 minutes, but it is quite an easy document to move through and offers a lot of information. And I'll talk about some of the supports available so that you can do an analysis of your organization about where you are at in terms of psychological health and safety and how you can start to address the gaps. So what is psychological health and safety in the workplace? So it is really an analysis around 13 factors. And so these 13 factors are listed here. So psychological support, organizational culture, clear leadership and expectations, civility and respect, psychological competencies and requirements, growth and development, recognition and reward, involvement and influence, workload management, engagement, balance, psychological protection, and protection of physical safety. So these are the 13 factors that create a psychologically healthy and safe workplace. And for those of you on the call who are connected to, HR within your organization, these are terms that you're really familiar with. But what it does is it brings them all together in a framework that you can consider as you start to make changes to improve the psychological health of your workplace, which will inevitably then, this is the hypothesis, will improve the individual health of employees within your organization, and therefore decrease your legal risks, decrease the costs associated with mental ill health in the workplace, and really help you fulfill your mission and create a more humane organization. So last year at our Bottom Line conference, we hold a conference every year on workplace mental health. We realized that this framework, even though it uses a lot of very easy to understand words and wording, that it was quite a big sort of concept to understand, and that this national standard itself does offer descriptions about what the factors are, but not everyone had time to go through it and really understood it very well. And so what we did is we created a musical around what the national standard was, and we identified what the 13 factors were. So again, we will send this presentation out to you, and you can watch the video. It's about 12 minutes, and it just kind of goes through what all the different factors are. This might be a good introduction to those of you who aren't familiar with this yet. So to start with, so what did we do here at BC Division? So one of the things that we've done here at our organization is we've done an analysis about how we're doing in respect to those 13 factors. And then we've developed action plans to create change. So what we started with a tool called Guarding Minds at Work. And Guarding Minds at Work, again, it will be sent to you, but it provides its survey. So you can register as a not-for-profit. It's free. You can put information about your your workplace in, and figure out what kind of demographics breakdown you would be looking for in terms of the findings that you'd be provided with. You send the survey out to all of the employees in your workplace, about 50 questions, and you get back a report, and it gives you an analysis of how you're doing according to those 13 factors. And it's free. And if you don't necessarily want to do a survey with all of your employees, what you can do is you can use the organizational review portion of that tool, and you can just with your leadership team go through all of the 13 factors and do a sort of an initial breakdown of how you're doing according to those 13 factors. And it provides you with a starting point. It's also a very interesting exercise if you're going to do both, to see where the discrepancies are. So how does leadership believe we're doing according to workload management, and then how do the employees feel we're doing in regards to workload management? And quite often there's a discrepancy, as you might expect, between those two findings. But nevertheless, even if you aren't able to do the survey, the organizational review documents are very helpful. Sorry, Marina, would you let me know how we're doing according to time?
Absolutely. We've got 15 minutes left. So
that's one tool that you can use. Let me also say that you don't always have to use a survey tool. You could actually, for example, I worked with one organization, and what they did is they had a staff meeting, and they put all the factors up on the wall and provided everybody with like 2 yellow stickies and 2 pink stickies, and they put descriptions of what all the factors were, and everybody had to identify 2 areas of strength and 2 areas of weakness, and they just went up and they put the stickies according to how they thought they were doing. And that actually was, was an interesting exercise, and it got the discussion started. So another topic I just wanted to touch on, and this does relate to this, and I think some of our colleagues from Imagine Canada are on the call, but it's about accreditation. So accreditation is one way that you can address governance within your organization. So when I'm talking about psychological health and safety in the workplace, I think the other piece is really, and I've asked you many questions about what your board is looking at and what kind of reports they're asking for, but there is an opportunity to address governance. And I think even for those of you from Imagine Canada on the call, perhaps there's also an opportunity to take some of those standards that you're looking at and bring in some concepts around employee health. But yes, what Imagine Canada does is it provides a series of different standards that your organization has to meet, and some of those are related to HR. So it's another way of addressing governance within your organization, and it's very complementary to the work that you're going to be doing in regards to the 13 factors. So here are some other resources. HereToHelp.bc.ca is a BC-based resource, and it is evidence-based, and there are tools in there and research materials, and they're all very well researched, and you can use those within your organization. You can provide links to different tools within Here to Help, and I would suggest you go through the site and potentially even subscribe to the Visions magazine that we do issue, and maybe that's another tool that you can look at having in your organization to provide people with more information about specific mental illnesses or issues related to mental illness. The Great West Life Center for Mental Health is a free resource available to people anywhere in the world, and Marianne Baton, who those of you who might be familiar with her, she is the program director there, and they provide a a huge amount of tools for not-for-profits, for-profit organizations to address mental health in the workplace. They have presentations that you can give to your leadership team. They have tools to help you develop your own emotional intelligence. So if emotional intelligence is something you want to develop with your teams, then use the tools that they have available. They can benchmark where they are, and they can identify goals for making change. The Mental Health Commission of Canada also offers a series of free webinars related to this topic. So again, I would also recommend looking at some of the webinars that they have posted there, and also the tools they have available through the Commission. So CMHA has been working in the area of workplace mental health since 2001. And we offer a series of different workshops and employee engagement opportunities. In BC, we host a screening program, so employees can get access. They can go through a screening program where they have information about their physical health and their mental health, and they get a report. The employer gets an aggregate report to see how employees are doing, and that's one of the ways that they're addressing mental health on a proactive basis. I would recommend getting in touch with your local CMHA, and if you are interested in more information about some of our workplace training, we have a collaborative through our national office, and there will be a link available through there, and provides a series of different resources and supports and training for workplaces across the country. And we're always happy to work with our not-for-profit partners. So again, we have different workshops. One of the gaps we recognized early on was that quite often supervisors do not have the tools to respond to signs of mental illness in the workplace. So they might see changes in behavior with an employee, and they're never quite sure what's at the root of that. And sometimes it's because they don't have the tools to have the conversation with their employees. So we do offer training through our Mental Health Works program, and it is available across the country to train supervisors and managers. Almost all the CMHAs, if you are looking to raise this as an issue within your workplace, connect with your local CMHA and consider having an awareness presentation. Quite often I'll go in to do presentations around workplace mental health, and I'll bring in individuals who have a lived experience of mental illness in the workplace, and just allowing people to ask them questions. It really does break down some of the fear and stigma within different environments. In BC, we also offer specific training for occupational health and safety representatives. Those of you who are interested in implementing the national standard on psychological health and safety in your workplace, it is an analysis of the 13 factors, and then it's also about developing an action plan and evaluating the effectiveness of the actions you're taking. And for those of you who are looking at championing that within a workplace environment, we do offer training. It is a little bit more expensive, where I think we'd be willing to have these conversations with not-for-profits that are interested in pursuing this. But it was developed by Sarika Gundu, who works at our national office in consultation with the Great West Life Center for Mental Health, and we will be offering that on day 2 of day 3 and day 4 of our Bottom Line conference this year. Again, here's some information about the conference. And again, if you are an employer that is doing great work in this area, please do complete the nomination form for the CM Hinks Award so that we can recognize you at our conference. We're always looking for great nominations from the not-for-profit sector. And sometimes it's just a question of getting the conversation going within your workplace. And it's hard to break down the barriers in an organization to get people talking openly about mental health in the workplace and some of the struggles that they're having or that they might be recognizing in their coworkers. So one of the ways you can do this is to access information, just look at opportunities to get the discussion going in the workplace. So yes, it might be an awareness presentation, but it could just be celebrating Mental Health Week. So in May 2016, we have a campaign called Get Loud. And it celebrates Mental Health Week, and we have a whole series of tools and resources available that we'd be happy to share with you so that you can start these conversations, very important conversations within your work environment. And I would also recommend that if you do have employees that are willing to tell their stories, that you use the communication tools you have available to tell their stories, to interview them. But when it comes to individuals, and after this I'll start taking questions, but when it comes to individuals in the workplace, if you do think that something's going on with one of your colleagues, really the best point of contact for that individual is once you've had that conversation, talking about what you're seeing. I've noticed that you seem different. Is there anything I can do to help? I'm wondering what's going on for you. Some of those conversations are very important beginning the beginning part of their recovery. And so you're in a great position to help them access help. But definitely their doctor is their best first point of contact. If you do sense that there's a risk of harm, of course there's a crisis line in every province and territory and maritime across the country. So definitely refer them to a crisis line if you feel there's an imminent risk of harm. Again, CMHA's, the Canadian Mental Health Association across the country, we have branches all over the place, and if you call us and you're just looking for information or resources, we'd be more than happy to respond. Again, if you have an employee assistance plan, I would find out what is covered within the employee assistance program. I would try using it yourself and then see how you feel about recommending it to a colleague. And quite often, they're excellent resources for individuals. If you have a union, quite often that's a good way to start the conversation, especially when it comes to implementing the National Standard on Psychological Health and Safety. The union will be a key partner in that initiative. Again, check out your benefits plan to see what kind of psychological services are available. And if you're looking for just general information about mental health, definitely check out heretohelp.bc.ca and find out some more information. You're not there to diagnose what might be going on with a colleague or an employee or direct report, but knowledge is key here. So I think getting the information that you need to help others is always an important part of the journey. So there's a couple of free and low-cost resources that we have in BC, and we are steadily rolling these out across the country. And I'd be happy to provide you with more information about both. Living Life to the Full it operates within a group environment. So there's 8 sessions, and whoever they are, if they're employees or individuals, they learn skills to address problems differently. It's based on cognitive behavioral therapy, and we are starting to roll out their program across the country. And again, Bounce Back is another support program that we offer through individual coaches who can help individuals, work through different challenges that they're facing. And this is all done, Bounce Back is done by telephone, so it is accessible to people regardless of where they are. Okay, so I know that was a ton of information. I hope that their handout that we send out is going to be helpful to you, but I'd love to hear your questions.
Wonderful. Thanks, Julia. So yes, just as a reminder to everyone, we are going to get that slide deck out to you tomorrow with the recording. So you'll have all those hyperlinks available with all the resources that Julia was sharing. So Julia, let's get to a few questions. First of all, we had some interest in what the CMHA does with their staff. Can you speak a little bit maybe about whether there's specific training for supervisors that you guys provide or programs that you have that support your employees' mental health?
So here, I can only speak to what is happening here at our BC division office. So I don't necessarily have the information for all the other locations across the country, but for what we've done here is we did start with the Guarding Minds at Work survey that we rolled out to all staff, and that really helped us identify areas of strength and areas of weakness. So things that areas we can improve on, and we have since developed some actions around what are some of the changes we need to make to better support employees. So we have, and sometimes they're really simple. Like sometimes, if you have an occupational health and safety committee, maybe making psychological risks part of the agenda would be an important part of making change in that area. So they're not always complicated actions, but we have taken some actions and then we evaluate every year. So usually around now we send out a survey to all staff to benchmark how we're doing, and our board does receive a report on that. In regards to other programs that we offer, because we do have our Living Life to the Full program available to the public, we also make it available once a year to staff, usually during Mental Health Week. We start the program at that time, and so they can all access that program and learn some new skills to tackle problems. We obviously talk about mental health quite often, but sometimes in a lot of helping professions, we tend to help others. We don't necessarily focus on ourselves, and we aren't self-reflective enough. So even though I think we are doing a lot to support staff, and we do have conversations about our employee assistance program, we talk about our psychological services available to support staff, this is something that we continue to need to pay attention to so that we are identifying risks and addressing them early.
Great. And going back to some of the legal pieces that you were talking about, now I know that you can't speak on an actual legal basis, but with the duty to inquire that you were speaking about, is that a federal or a BC regulation?
It's neither, actually. It's coming out of, and again, I'm not a legal expert, but I do a lot of presentations with legal experts, and it's coming out of case law. So it's really coming out of, different lawsuits that employees are filing, and that is sort of changing the expectation around what employers need to be doing. And I don't have the exact case that I can reference, but there have been cases where employees had a pre-existing diagnosis of a mental illness and then began to display, changes in behavior. And if the employer had inquired about those changes, they would have had the opportunity to realize they're connected to the underlying mental health issue, and they didn't, and the employee sued. And so some of the duty to inquire is not coming out of regulations or legislation, it's coming out of case law.
Wonderful, thanks. That clarifies things, I think. Now, we had a few questions about if an employer does make the inquiry, but the staff person maybe says there's nothing wrong or is refusing to get help, do you have any suggestions on what the employer should do next?
So yes, so you can't force someone to access help. You can't make assumptions about what you think is going on. I think it's a delicate area. I think it comes down to, quite often it comes down to trust. Does the employee trust that you're asking out of sincere concern and care? That might affect whether they respond honestly or not. I think sometimes people in an employee, quite often, I don't think that they might not respond positively the first time, but quite often you might not be the only person who's noticing those changes in behavior. It's likely that their spouse or someone in their closer circle has also mentioned some of these changes, and they were, tended to disregard them. But as soon as they start to hear it from different people, quite often that'll be the impetus to access help or speak to their physician. So you might not be as successful. I guess my point is that you might not be successful in helping them access help the first time you have the conversation, but don't give up, because sometimes you might need to just let them know that you're there in case they are looking to help, to speak to someone, or they are interested in, maybe accessing some of the supports in the organization that they might not know about. So I would suggest always staying in touch with the employee and following up. And most importantly, I think it's a question of being self-reflective about what you're bringing to the table and your expectations, and responding to changes in behavior with sincere care and concern for the individual.
All right, thanks, Julia. And I think we'll just end on this question today. Amy asks, we have a small staff and lots of student volunteers. Do you have any suggestions on how to integrate mental health tips or info when interacting with the volunteers and staff? Is it best to do it through training or check-ins, or are there any other suggestions that you might have?
Yeah, I think, orientation is an important part of getting employees prepared to do the work in front of them. So I think anything you can touch on in terms of the orientation when it comes to what are the resources that you have available to your organization, and they don't have to be things that your organization is paying for. They could be supports available in the community. So do a bit of research about what is available in your community. Maybe contact the CMHA to find out about some of those resources. You check into your benefit plan if you have one. Do you have an employee assistance program? Do you have psychological services? Include that in the orientation with employees. And then, again, as I mentioned, heretohelp.bc.ca has a ton of fact sheets and information, so why not pull out some of those fact sheets and put them into the orientation package, post them around your organization, celebrate Mental Health Week. What you're doing now, Amy, is accessing this webinar, so obviously there's an interest, so, continuing to access the free resources that you see available. And of course, like, personal check-ins is always important, so I would never suggest that all of those things can be done without actually talking directly to the individual and creating a relationship of trust with your volunteers and your staff. So, checking in, noticing changes in behavior, not being scared to mention them if you do see them, and always inquiring with a sense of care for the individual.
Wonderful. Well, thank you so much, Julia, for a great presentation. Lots of info there, and I think you presented some excellent resources for people. So, just before we sign off, I do want to remind you all that we are going to follow up with you tomorrow morning with the webinar recording and the slide deck. So you will get all of those resources together in a slide deck for you. We're also going to include a link to a very short survey. So if you can take 5 minutes just to fill that out, it's really helpful for us to help us refine our webinar content and our delivery. And you'll have an opportunity to let us know if there's other topics you'd like to see covered in a future session. On that note, we do have another webinar coming up on December 10th. We're going to quite a different topic next month. We're going to be discussing how to prepare for a major gift request. So if we have any executives or fundraisers on the call today that do major gifts, you may be interested in attending that. There will be a link to register in the email that you receive tomorrow. So I want to thank you all again for joining us today to discuss this very important topic, and I hope you have a wonderful rest of your day. Thank you very much.